Today we are going to be looking at the axilla, and the axilla is a fat-filled pyramidal space located between the upper part of the arm and the lateral part of the chest. You can also see that it is located inferior to the glenohumeral joint, the part where the arm joins the thorax. So we're going to be looking at the axilla under the following synopsis. We have the introduction, we have the boundaries. Under boundaries, we have the apex, the base, the anterior wall, posterior wall, the medial wall, lateral wall. We have the contents and clinical correlation. So we'll be looking at the axilla under the synopsis I just showed you. We have talked about the introduction where we said it is a fat-filled pyramidal shaped space. So we're looking at the boundaries. The axilla has an apex, the base, and four walls. That's the anterior, the posterior, the medial, and the lateral wall. I will show you a picture shortly. This is the transverse section of the axilla. In this diagram, we can see the boundaries of the axilla. We can also see the contents of the axilla. This is the anterior view, this is the posterior view, this is the medial view, and this is the lateral view. We can see the pectoralis major muscle and the pectoralis minor muscle forming the anterior wall. This is the intertubercular sulcus of the humerus forming the lateral border of the axilla. We can see the scapula and the subscapularis muscle originating from the subscapular fossa of the scapula forming the posterior border. We can also see the latissimus dorsi muscle and the teres major muscle still forming the posterior border of the axilla. We can see the first rib and the serratus anterior muscle on it, forming the medial border of the axilla. Here we can see the contents of the axilla. You can see these are the axillary lymph node, these are the cords of brachial plexus, this is the axillary artery, and this is the axillary vein. The long head of bicep brachii, the short head of bicep brachii, and coracobrachialis muscle, all of which forms the contents of the axilla. So in the picture above, we can see that the apex is bounded by the clavicle anteriorly, the posterior part of the clavicle anteriorly. It is also bounded by the upper border of the scapula up to the coracoid process. You can see it there, up to the medial border of the coracoid process posteriorly, and the first rib medially. The apex can also be called cervico-axillary canal, which allow transition of vessels and nerve to enter the arm, the upper limbs. The base of the axilla is formed by axillary fascia and skin, but anteriorly it is bounded by anterior axillary fold. The pectoralis major muscle forms the anterior axillary fold, and posteriorly it is bounded by posterior axillary fold, which is formed by the latissimus dorsi muscle. In this photo, we can see the lateral part of the pectoralis major muscle forming the anterior wall of the axilla. This is the arm, this is the lateral part of the chest, and this is the P major forming the anterior wall of the axilla. So in this photo, after removing the P major muscle, we are seeing the clavipectoral fascia. But deep to that clavipectoral fascia, since we are talking about axilla, we can see the P minor muscle. We can see it coming laterally, contributing to the anterior boundary of the axilla. And if we are to remove this clavipectoral fascia, we'll see the veins, the axillary vein, the axillary artery, and some cords of brachial plexus, which is part of the contact of the axilla. So I showed you a diagram of the anterior boundaries of the axilla, which is made up of pectoralis major muscle and pectoralis minor muscle. The lateral wall of the axilla is formed by the intertubercular sulcus of the humerus, and the medial wall is formed by the first four ribs and its related intercostal space, then serratus anterior muscle, which overlies the four ribs. So in this diagram, you can see clearly the anterior view of the axilla. The P major has been removed, but the P major I've showed you before comes laterally. The lateral part forms the anterior boundary. This is the P minor, the lateral part. And if we look here, we can see the serratus anterior muscle, which is overlying the first four rib and intercostal space, which forms the medial wall of the axilla. And the intratubercular sulcus forms the lateral wall of the axilla. The lateral border of the axilla is formed by the intertubercular sulcus of the humerus. We have the contents of the axilla. We have the cords of brachial plexus, axillary artery, axillary vein, axillary lymph node. We have the long thoracic nerve. So with this picture, we can see some of the contents of the axilla. You can see the axillary artery. You can see the cords of brachial plexus. You can see the long thoracic nerve. This nerve here, this long one that is coming like this. And the axillary vein has been cut off here. But remember that it continues upward. The basilic vein continues upward to form the axillary vein, which after passing the first rib, which is this rib, it becomes the subclavian vein. So had it been the axillary vein was in this picture, would have seen it here. Then we can see the cephalic vein coming, moving medially to come and empty into the axillary vein. But the axillary vein is not here, so it has been cut off. But you can just imagine an extra vein here forming the axillary vein. And some of the axillary lymph node and all of that is not in this picture. So we can see the boundaries of the posterior wall of the axilla through this photo here. This is the latissimus dorsi muscle, this is the teres major muscle, and this is the subscapularis muscle. You see that it is bounding the axilla posteriorly. Under clinical correlation, we have the thoracic outlet syndrome. This is due to compression of nerves and vessels which passes through the cervical axillary canal. I told you that the cervical axillary canal is found at the apex of the axilla. And this condition can occur either due to fractured clavicle or an extra rib, or repetitive movement. So it causes compression of the nerves and vessels which passes through this canal. I hope the video was helpful. Please don't forget to subscribe, like, and share. Thank you.